There's been quite a lot of discussion, very interesting discussion happening online and very interesting questions. Most of the questions, there are quite a few coming for Dan, Hilary and Ashley, asking how can we work together? So they come from individuals, institutes, universities, academics, all over the world. That's so. Do we have Dan online? I see Hilary. Hi Dan. So how can others be part of who are very interested in institutions and so on? How can they work with us?
Mm-hmm. Yeah, thanks, Arlinda, and thanks for that question that numerous people have posed in the chat. I see. And it's a great question. I see kind of different levels. First of all, on the kind of maybe the broadest level, we sent out some information about the RST interest group, and so you would be aware of different presentations and things and be able to follow along with us and input with us. We certainly welcome your participation and ideas. So that's kind of the easiest level, if you will. The harder level, despite people's good intentions, some people wrote and said, how can I join the RST? The RST does represent a team for which we have a specific engagement and specific commitment to, and that implies financial and other commitments. I went through this morning some of the issues in terms of the training involved and the occupational health issues. So it's not a matter of, despite people's good intentions, there's no way just to kind of sign up and be on the list, because we do require a little bit more engagement. Having said that, we also think that strategically the best way for a sustainable effort on our side is really to work through institutions, and they can be ministries of health, they can be regional, they can be global. We work a lot with Africa CDC, for example. And so really that would be probably the best way. If you can contact us through your institution, it doesn't mean that you can't make the contact, but you need to be a representative of the institution, because we really need to make sure that we're doing our best to have long-term impact and not necessarily investing on an individual impact, although we certainly understand the individual's interest and the expression of ideas with us. Maybe I'll stop there, Linda. Thanks.
Great. Thank you, Dan.
And yes, emails to William Nicholas for the RST group. Somebody just put in the chat.
Yep. Would you like to say something about bilateral deployments? Maybe to that.
Same principle, in that bilateral deployments come from expressions of need and interest from agencies, again, not individuals. And so as we heard about just a few minutes ago, we've deployed through bilateral engagement with Nigeria CDC on numerous occasions, and also have numerous research projects with them. Those have come in the first instance through Chikwe calling me up and saying, here's the situation in Nigeria right now. They can also come through other government channels that eventually make their way through me, but yeah, the same principle is that it should be representative of an agency's response and agency's need.
Great, thank you, Dan. Hilary and Ashley, would you like to add something else to that?
No, I think Dan's covered it for me. Thank you.
Okay, thank you. Another question comes from Katie. Katie Moss is asking, does DHSC have any collaborations in Kenya?
Hiya, thank you. So there's a couple of examples of existing collaboration with Kenya, between Kenya and DHSC, and that falls within projects in our wider portfolio of global health security programs. So, for example, last week, the Foreign and Development Secretary visited the Kenya Medical Research Institute laboratory in Nairobi, where he heard how Kenyan and British scientists have been working together to develop trials for the Oxford AstraZeneca vaccine, with funding from the UK Vaccine Network, which is one of the projects in our wider global health security portfolio. During his visit, he signed a new health partnership with Kenya's health minister to help maximise knowledge sharing between medical professionals in both the UK and Kenya. And then secondly, some collaboration on antimicrobial resistance. The Fleming Fund, which is another one of the projects in our portfolio, has a country grant worth up to £6 million in Kenya. This is developed in partnership with the government of Kenya, and it's aimed at supporting the country's national antimicrobial resistance action plan. And it does that by reinforcing existing surveillance systems, strengthening laboratory infrastructure, developing human capacity or technical skills, and using protocols for appropriate antimicrobial use.
Thank you very much, Katie. I hope that that answers Moses' question. The next question is for Hilary from Samantha. And it's a question that I think it's very close to Hilary's heart as well. How does UK-PHRST address cultural differences in conveying research and policies?
Okay, thanks, Samantha, for that question. I think that the main way we do this is that we try, and we will be trying even more in the future, because we've been developing our processes over the last 5 years, to make sure that we work with collaborators in the field. And when I say that, I don't mean I think of an idea, I turn up in the field and I say, would you like to collaborate with me? Because, okay, that's a collaborator, but it's not the collaboration that we want to pursue. What we want to do is really start from the beginning with our different partners. I mean, you've heard from Nigeria, CDC, I've mentioned Sudan, we have people in Vietnam, in Philippines, in Malawi, and different places around the world where we're starting to say, look, what are the issues? What are the research priorities? Now, clearly, we can't address everything in the world, but when people come to us, or we are working together in a deployment, or maybe we're there to help with a capacity development of a rapid response team, what we're doing also is talking about research. We're talking about our triple remit. And what we want to do is get those questions coming out. Now, your question was around culture. I can't know everybody's culture. And I shouldn't. I should really be taking the lead from our collaborators, and that's what we're trying to do. Over.
Thank you, Hilary. As a question for Ashley and Dan, I believe, and Hilary as well, it's how would you recommend getting involved in organizations like UK-PHRST or GORN for someone who's just starting out in a career in epidemiology? Any specific experience to gain or training to complete? Who would like to chip in?
Ashley, thoughts on that?
Yeah, thanks. So I think there's many possible avenues, and epidemiology is a very broad church. So it depends if you're interested in more of the academic research side or more of the field epidemiology side. Obviously, around the world, there's many and growing institutions, public health institutions that need you. They need bright young minds to be developed and to be able to contribute in your field. So having understanding of the public health landscape in your country would be a good starting point. Making connections, reaching out, opportunities for shadowing can be very good, can be very valuable. There are some well-established kind of career development, workforce development programs, for example, the FETP, which we're going to hear a bit more about. And engaging with networks as well. I think there's many networks that are subject specific. Dan's mentioned about the ASTMH and the Royal Society for Tropical Medicine, also WHO and GORN network, things like that. So engaging with professional networks, engaging with the landscape, building your networks, building your connections. These are the kind of things I can think of off the top of my head. There's many more that could be said. Maybe Dan wants to add to that, or Hilary.
Thank you. And GORN, people are asking about GORN as well. Any idea?
Maybe I can jump in. So in addition to the things that Ashley has mentioned, I think if you're really starting your career, it's also good to look at your own country, because Dan explained that after the West Africa Ebola outbreak, there was a real move to develop rapid response teams. And many countries of many different kinds and different areas have set up rapid response teams. And although Arlinda has mentioned Goan, for example, but Goan will often take people who are quite high level. So if you're starting, and you can start in your own country and get some real field experience as an epidemiologist, doing case contact tracing, doing all the tasks that you would need to do in an outbreak, this really gives you some solid foundations, as well as all the other networking and the qualifications and so on. Over.
Thank you very much, Hilary. And I'll ask just one last question to Kola. So there are basically two questions. Again, how can people become part of the NCDC team as health workers? And how do you build trust among Nigerians in this current COVID-19 pandemic?
Well, thank you, Arlinda, for that question, and for the person that asked the question. For NCDC to be part of NCD, number one, you have to know that NCDC is a government institution, and as such, there is normally a kind of recruitment through the normal process of government recruitment. That's number two. You can work with NCDC as an employee of NCDC. That's number one. Then secondly, you can be part of NCDC if you're a member of a partner organization that we collaborate with. Through that, you can be part of what we do. Then thirdly, through internship program, there are actually internship programs on the website of NCDC where you can apply to. If you are a fresh graduate, if you have done something on feed epidemiology, and of course you can come for internship program through that platform. And also, if you have qualification around public health, of course we can also recruit you as one of the technicals of NCDC. Then the second one has to do with the building trust among Nigerians. I think building trust is, if you look at my slide when I presented, that was the last point I mentioned, that that is a very critical part of our work, in the sense that you have to build trust for people to actually change their behavior. People have to believe in what you say. So as such, we do a lot of risk communication activities to all Nigerians through different channels, through our website, through Facebook, through Twitter, even through physical, through one-on-one, because we go into different communities and we work very closely with the states. So you have to carry them. And for instance, we are the one leading COVID-19 response in Nigeria now. We provide daily updates for all Nigerians, and they know the number of cases that we have confirmed every day, what the NCDC is doing, and so on and so forth. So building by all these risk communication activities, by interfacing with Nigerians, of course, we are building trust in carrying them along about what to do. Thank you.
Thank you, Kola. So I hope